The prescription abbreviations shown on the left side of the table should not be used because they are error prone. So instead, you should use what is shown here on the right side of the table. There are other error-prone abbreviations out there, but these really represent the most common ones that you will see asked about on a nursing school exam. So instead of MS or MSO4, you should use morphine. Instead of MgSO4, you should write out magnesium sulfate. We should not use decimal points without a leading zero. So the example here is 0.5 milligrams. And if you can't see the decimal point, it will look like 5 milligrams. So instead, you want to use a leading zero, so 0.5 milligrams. We also don't want to use trailing zeros. So in this case, we have 2.0 milligrams. If you don't see that decimal point here, then that looks like 20 milligrams. So we want to leave off the trailing zero. So in this case, we just want 2 milligrams. We don't want to use U or IU and instead write out units. We should not use QD and instead write out daily. QOD should not be used. Instead, write out every other day. And then SC and SQ should not be used for subcutaneous. So instead, you can write out subcutaneously or sub-Q.